Hello everyone, welcome and thank you so much for joining us today. My name's Liz McNeillie. I'm a speech and language therapist working for Impact, and I'm introducing the webinar today. So this webinar is about how we've implemented an early years care pathway in the UK. And it's a pathway designed to support neurodivergent infants and their families from age 11 months. So it's pre-diagnosis, and it includes the PACT and iBASIS programmes as part of the pathway. A key part of my role involves implementing the pathway with NHS partners. And from my perspective, it's been great to be able to provide that really early support to parents and babies at a really critical period of the baby's brain development. I really enjoy seeing the baby's communication develop over the course of the programme and having the opportunity to work with families for up to 6 months, and parents report feeling more bonded with their baby. So the presentation today is pre-recorded, as we really wanted to include the perspective of one of our NHS partners who couldn't be here today. Her name is Jane Harris-Waller, and she's the neurodevelopmental clinical lead in Coventry and Warwickshire, where this neurodevelopmental pathway is being piloted at the moment and implemented. My colleague Sue Vosper is also presenting in the presentation today, and she is able to be with us, so she'll be available for questions at the end, and I'll let her introduce herself when we get to the beginning of the presentation. So I believe we have a mixture of professionals, parents and carers here today, and sort of who watching our webinars as they're recorded on the website, and you are all very welcome. And we hope that the content will be accessible and useful to all of you. And anyone who does want to share their background and why they're here in the chat is very welcome to do so. So before we begin, just a quick note that today's session is being recorded. The recording will be shared with you afterwards and will also be available on our website. So you'll be able to watch back anything you miss or share it with any colleagues or friends who you think might find it useful and interesting. We also have around 15 minutes at the end of the session for questions. So please feel free to add questions into the chat as we go along, which will be answered at the end, or you can hold your questions and ask us at the end. And questions from professionals or parents and carers are all very welcome. And me and Sue will do our best to answer them as we come to the end of the presentation. And can I ask everyone just to make sure that their microphone is muted as we go into the presentation so that we don't have any noise disturbance. So we're really pleased to have you here with us as part of this webinar series. The next session in our series will be Growing Together, the PACT programme and related therapies, and that will be delivered by one of our therapists, Wilson Mora, and we'll share more details of this at the end. And if you do want to see any of our upcoming or previous webinars as part of this series, they are all recorded on our website if you're not able to attend in person on the day. So for now, we'll get started. Please let me know if anyone has any difficulties hearing or seeing the presentation.
My name's Susanna Vosper. I work for Impact CIC. It's a voluntary sector organisation, and we provide support to NHS partners as well as internationally around autism care. I'm a speech and language therapist by profession. I moved from Manchester Foundation Trust last year to solely work on this pathway work, and I'll be presenting with Jane, who's the principal clinical psychologist for Coventry and Warwickshire Partnership Trust, and Liz is on hand to answer questions. So next slide, please. Is it okay? Oh, thank you. A bit of a lag. So we're here today to present on an evidence-based early years neurodevelopmental pathway, and it's been designed to provide or reduce the detection gap and care gap between identifying children very young and then offering support at the earliest possible stage in order to improve developmental and life outcomes. And we've shown from having implemented this for the last 3 to 4 years that it positively impacts the child's needs beyond the early years. So it reduces needs downstream and can impact, we hope, on autism assessment services as well. Next slide, please. So why are we thinking about this preemptively rather than reactively? Well, having worked on an autism assessment pathway for Manchester, traditionally models of autism care have focused on providing support to autistic children and young people at the point of diagnosis. This pathway moves away from solely relying on that. It's preemptive, so pre-diagnosis, it's needs-led, needs-based. So we're identifying the child's needs very early on and offering early support to the family to try and boost resilience. And we hope also to reduce pressure on autism diagnostic services downstream. So it's efficient. We know that we are reducing children's needs early on, and this also impacts on things like waiting lists within the NHS because we are offering this earlier support. It's effective. We've got lots of evidence that families are very happy to get this earlier identification, earlier support. We know that the therapy programs we offer boost bonding between parent and child, as well as actually supporting the child's development. It's cost effective. We know from various research conducted by Professor Green, who I work for, that earlier support reduces costs downstream because we're reducing the children's needs. It's proactive. We're getting in there early. We know that autism is developmental and enduring, so the support is starting at the earliest possible point. We've mentioned that it's very linked detection and care. So as soon as we identify the children, we're offering immediate support, and it's evidenced. The identification tool and the therapy support have strong evidence bases from research trials, and it's flexible. So we can deliver this now with existing staff teams by redeploying them for maybe a day of their time a week, but also building it in, dovetailing with existing service offers. Next slide, please. So the pathway elements include the SACS-R, which is the surveillance tool. So it's the social attention communication surveillance revised tool. And that's a detection tool that identifies children from as young as 11 months who may be at high likelihood of autism. In other words, they're showing early signs of autism. However, this is a surveillance tool. It's not a diagnosis, absolutely not, but it shows likelihood and is very strongly evidence-based. What's nice about this tool as well is that it can be implemented at different time points up to the age of 6 years. So it can be delivered by frontline workers, health visitors, and early years workers to build up a picture of the child across time. So we use the SACS-R to identify the babies from 11 months. And then for children who are under 2, we offer iBASIS, which I'll talk about in just a moment. And for over 2, we offer PACT. Again, I'll talk about what both those things are. And again, this can link with existing services. So if a service is already offering other things, these can sit alongside that offer. Next slide, please. So the SACS-R I've mentioned is a brief monitoring tool. It identifies likelihood of neurodivergence and therefore can indicate need for referral. What we found on the ground with the implementation pathways we've been delivering is that it's actually really effective in identifying children who aren't neurodivergent as well. So children who are showing perhaps more language needs will be diverted to the appropriate care sooner. SACS-R is also really applicable in a day-to-day scenario. It's a short play-based assessment. It takes about 15 minutes to deliver, and it can be completed within usual mandated visits. So health visitors feedback to us that they really like it because it can help with their decision making and is really easy to administer. Next slide, please. So iBASIS and PACT are the therapy components. So it's the support once we have identified the neurodivergent children and babies. Both iBASIS and PACT are video feedback based. So iBASIS stands for originally Intervention for the British Autism Study of Infant Siblings. So it was originally designed for infants who had an older sibling who had an autism diagnosis. But these days we don't rely on children having necessarily a sibling in order to access it. It's more whether they are showing those early neurodivergent signs. And PACT stands for Pediatric Autism Communication Therapy. They both use video feedback to inform a discussion with parents to look at signals that the child might be giving, sort of when the child is making overtures to start an interaction, and building those attuned caregiver responses. It's strength-based, and I just want to stress it's always based on what the child does first. So it's very neurodiversity affirming. It's totally accepting the child as they are, but building on their strengths. They're both strongly evidence-based. Both have had RCT trials, and PACT actually followed up children up to 7 or 8 years. iBASIS followed the children up to 3 years and found that the changes to their development were long-lasting. In order to deliver iBASIS and PACT within this pathway, we identified teams of about 5 specialist practitioners who would accommodate this work by delivering it for a day to a day and a half per week. So it might mean that they do slightly less of something else in order to accommodate this, but we're not trying to employ new staff teams. We've based this on a population size of 300,000, so it would be adjusted for different localities, and it's delivered by specialist staff. So it's a very flexible model. iBASIS and PACT can be delivered by health visitors, by speech and language therapists or assistants, by OT assistants, by neurodevelopmental practitioners. There are lots of professionals who potentially could deliver this therapy. Next slide, please. So a brief bit about iBASIS. I've mentioned that it's a video feedback program. It works through parents, and I've mentioned that it enhances the infant's communication potential through supporting parent-child interactions, as well as increasing parent bonding. Next slide, please. And here are a few outcomes from PACT, which works in a similar way. Some of the tools are different, and the way we feed back as therapists to the parent. However, we're still using video feedback as the main mechanism. So you can see from these quotes that parents really like it. They have goals that they work for, that they identify, that it helps them to feel more tuned in to their child and to understand their child when it might be sometimes difficult to interpret their child's communication signals. Next slide, please. So outcomes. So once the child has travelled through the pathway with their family, the iBASIS and PACT therapist has really got to know the family over about 5 to 6 months of care. And in that time, the therapist or practitioner has built up and captured a lot of detailed information and observations about that child. So that puts the therapist or practitioner in a very good position to make recommendations for the next stage and to consider whether there's a need three E's there, but need for autism assessment. So at the end of the therapy programme, the SACS-R is repeated just to see the child's likelihood of autism, because for some children after iBASIS and PACT, even over 6 months, they may fluctuate in their score and their needs may already be reduced. Although we know from the control trials that it's generally over time that we see those developmental outcomes really shine through. So at the end of the therapy input, there are different possible outcomes for the families. Some families are really happy with the progress their child's making. They feel in a good position to best support their child, and they go to review, and a diagnostic assessment is no longer required. Other children will be really well supported in terms of their social communication and their development overall, but may have other identified needs. For example, language is becoming more of a need, or they may have sensory needs, so they will be signposted to those needs accordingly. A third group may still look as though they need an autism diagnostic assessment, but this hopefully will be a lighter touch assessment, because we now have lots of information from the practitioner working with the child, depending on the age of the child when they complete iBASIS or PACT. So for a baby who may be finishing at sort of 2.5 years, some of that information can feed in if they are then going to be assessed at, say, 3 years. And then for the fourth group, they will still need a really full detailed MDT assessment and diagnosis, because they may either not be scoring consistently, or they may be scoring more on the threshold, so showing some neurodivergent characteristics, but also lots of strengths as well. So those are the different outcomes for the families, but it hopefully will reduce the burden on the autism assessment teams. Next slide, please. So we have carried out this pathway. The under twos part has been carried out in Stockport in Greater Manchester, and other parts of Greater Manchester, Bury is also adopting this pathway. And here in Coventry and Warwickshire, the full pathway is currently, I've put preparing to mobilise, but it's actually mobilising now since writing these slides. So I'm going to hand over to Jane shortly, but just before I hand over, just to give you a couple of takeaways from what we found from Stockport and Bury. So if you could move on to the next slide, please. So we found that we were upskilling the workforce as a result of doing this pathway. Infants and children have been identified earlier and offered evidence-based support at a much earlier stage in their development, reducing needs. We've got very positive feedback from families who've all, I think 99% of the families we spoke with said it was absolutely the right time for them to be getting that support. They don't want to wait longer, they're happy to get it then. And interestingly, comparing some families who had autistic older children who'd had to wait longer, they really sort of wax lyrical about this pathway. So we get very positive parent feedback, and we're obviously offering earlier support, and we have seen a reduction in referrals to specialist services. So for example, in Stockport, in the child development unit, there's been a reduction of the amount of children who've been referred on, and the next slide shows that. If it's okay to move us on. So this shows a reduction in the amount of referrals for 2024 from 2023. And that was due to reducing the waiting list, but also reduction of children who actually required the autism assessment, having had the therapy. Next slide, please. So I'm now going to pass you over to Jane, but this slide shows how it actually works on the ground. So the first sort of 6 months is the preparation stage. So in thinking about practicalities, If a locality is interested in this pathway, like we said, it's very flexible because it can be individually adapted to localities and can dovetail with what localities are already offering. We spend time in the first 6 months preparing to mobilise, and that's what we did with Coventry and Warwickshire. So there's been a lot of, it's a collaborative process. So we've worked with Coventry and Warwickshire discussing the system, speaking with key stakeholders, completing a readiness tracker to find out who might be the best teams to deliver the therapy, who's going to use the SACS-R. And in Coventry and Warwickshire, it's mainly the community nursery nurses who identify the children. There's lots of information governance, as we know, having worked in the NHS myself for a long time, to complete at this stage, and then identifying the staff for training and their capacity. And then in the next 6 to 12 months, that's where we start to implement the training, and the staff teams begin to actually picking up working with their families and starting to mobilise. And it's really from about 12 to 18 months onwards that it becomes part of routine delivery, and we start to see the pathway really embedding. So with Coventry and Warwickshire, we're really at this second stage. The training has just been completed, and we started it all in September. So we sort of worked through the preparation stage then. And staff are just starting to deliver SACS-R, or the iBASIS or PACT teams are just starting to see their families. So I'm going to hand over now to Jane to talk through the sort of practicalities on the ground and to give her perspective. Thank you.
Thanks, Sue. So as Sue said, we're still in the midst of implementing this pathway, but I'm really pleased to be here to share some of our learning to date, and think about what we've done so far and where we're going. If we can go to the next slide, please. So as Sue said, this real-world implementation in Coventry and Warwickshire is led by the Children's Neurodevelopmental Service within Coventry and Warwickshire Partnership NHS Trust, but it's very much a collaboration between 3 different organisations, as you can see here. So our kind of bigger collaborative team, we have our health visiting services in our 2 areas, Coventry and Warwickshire, who are provided by different providers, and they have been implementing the SACS-R developmental surveillance tool. Our iBASIS team, across both localities, we've created one team, and that's within our preschool autism services, which is provided jointly by Coventry and Warwickshire Partnership Trust and South Warwickshire Foundation Trust. And then PACT is being provided by our speech and language therapy services, which again have different providers across our 2 areas. So you can see within our locality, there have been some complexities with working with 3 different providers, providing organisations, and bringing everybody together to collaborate to provide this fantastic new pathway. So we'll talk a bit about how we got to this place. So if you can move to the next slide. So Sue was saying there was quite a lot of preparation in the first 6 months and before that in preparing to bring in this new pilot model. Something that I think really helped us to succeed with setting this up that was having in mind what the key benefits were for each service and each organisation involved. So as Sue's spoken about, us as clinicians, myself as the psychology lead, and my colleague at the time, Helen Harbin, who was the speech and language lead for autism, we were watching this research and really noticing, gosh, this sounds great, I wonder if it could work here. And it was a clinically driven development, with us approaching the clinical leads within health visiting and within our community speech and language services first. And once everybody there was kind of on the same page that this looked like it could be beneficial for all of our organisations and services, we kind of, as clinicians behind that, then were able to start approaching other stakeholders to look at how we could actually deliver this locally through that collaboration. So that needed a lot of thinking about the capacity for the delivery. So support from our commissioners and having a dialogue with them at an early stage was really important, particularly because one of our health visiting services was transitioning between providers, as one provider to another, during this preparation phase. So that support from commissioning was really important in making sure that we could still implement whilst that change was going on. And support from senior leadership within each of the services was key as well. So us as clinicians really being clear about what the potential benefits were and how we could find ways of implementing, like Sue said, with our existing resource. So that involved agreeing how much time, how much staffing resource would be able to be redirected towards this pilot and how we would manage that, what the benefits would be. So through those conversations together between clinical leads and operational leads, we came up with a plan of where and how it would best fit in with our existing services. So with the SACS-R, as Sue mentioned earlier, it's been really sensible for us to implement that alongside our existing Healthy Child programme offer across Coventry and Warwickshire. So the universal offer from health visiting involves key contacts across the child's first 5 years of life, and we've added in SACS-R as a targeted offer within that programme. So some children who meet certain criteria will then be added in this extra opportunity for thinking with a community nursery nurse of whether or not autism is something to think about, whether they would benefit from a therapy like iBASIS or PACT. And then similarly, iBASIS, we found a way of fitting that alongside our existing diagnostic service offer. So as a specialist autism service, we thought it fitted quite well with us to be able to come in a bit earlier and offer that early detection and care. And it's our neurodevelopmental practitioners primarily we've had 8 practitioners trained in iBASIS. And what the real advantage of us doing that is that we offer diagnostic assessments from age 2+, as Sue was saying. So if we've already been working with a family providing iBASIS as the child is turning 2, it enables a really smooth, seamless transition that the child can then be referred in by their iBASIS practitioner, and they can liaise easily with our MDT, and we can use that information to inform their diagnostic assessment and giving a better experience, we hope, to the families. For PACT, that sits within our community speech and language therapy services, and again that's been situated alongside existing therapy offers. So children can be referred to speech and language therapy to have an initial assessment, and PACT is now an additional option for them alongside other existing offers, including things like the Hannon More Than Words programme. And we think it offers something new and different that allows us to serve for families who perhaps wouldn't have been able to access things like More Than Words that include a group programme that isn't suitable for everybody's needs. So having that individual therapy alongside is really beneficial. Okay, so we move to the next slide. And we'll just whiz through some aspects of the implementation. So a lot of our preparation work was moving towards this point where we had agreement from all of the organisations involved on our commissioning as well to implement, and we paid attention within that agreement to making sure that there was equity across our 2 areas and that what we were offering was similar and was a kind of coherent journey for people living across the areas. And we also had to address some issues around sustainability. So as Sue said, the first 12 months is just part of the journey. What was that going to look like going forward? So some of the things we had to think about was, after the training period had ended, could we cater for in-house supervision for our therapists? Could we manage that going forward and make sure it was sustainable within our organisations? As Sue mentioned, we then had to seek information governance and digital security sign off for these projects. They use video feedback. So that comes with a whole host of questions about how we're going to manage the consent gaining for video, who's going to have the video, where's it going to be stored, how are we going to make sure that people's data and information is safe whilst accessing this therapy. So we needed to do a DPIA, a data protection impact assessment, and get advice from our digital security as well. And it was really helpful to have support from Impact in doing that with the previous experience in other areas. Then we needed to look at our workforce development, so identifying for each part of the programme who would be best placed to offer that, and how are we going to enable the staff that we had already to be able to do that. So for the SACS-R training, our health visitors identified their community nursery nurses as the best people to do the SACS-R training, and that's because they are the people that are most likely to come into contact with the right people at the right time. And we had, I think it was 88 people in the end, staff members that have accessed SACS-R training, which is brilliant. I think kind of links with the themes that we heard earlier about upskilling the workforce, because then those people are across every locality now within Coventry and Warwickshire and able to kind of share what they now know about making observations of early signs of autism with their teams. We also trained the clinical lead health visitors as well, in the interest of sustainability, for them to provide support and oversight. The workforce within iBASIS and PACT, we had more staff who were interested in the training than we had abilities to train them. So we offered it out as a development opportunity and took expressions of interest from staff. We trained 8 neurodevelopmental practitioners or speech and language therapy assistants in iBASIS. And they've each been released from other duties for half a day a week to do this. And PACT, we've had 10 staff members from community speech and language trained in PACT. Then there was a process of as for any new adventure within a service, is creating a standard operating procedure and all the supporting documents that you need, things like patient leaflets, referral forms, letters, all of that. I think is very familiar to us, so we use those documents a lot, but it did take a bit of time and thinking about what was going to be suitable for this pathway. We also needed to think about gathering equipment. So I think we, as all of our organisations work hybrid now, so we're quite used to working online. So luckily we had a lot of the equipment that we already needed for working with video. But we also needed to pull together some kits, like toys that we needed to use for SACS-R. And actually we've managed to do that, fingers crossed, so far without purchasing much. We just needed to get some bags to put the SACS-R kits into. But a lot of the toys overlap with things that we used for other assessments, like the SOGS kit and ADOS kits, things like that were kind of around already in our offices. So yeah, it hasn't meant that we've had to purchase kind of lots of additional equipment. So we're now at the point where our staff are trained, we've got all our equipment together, we've got the sign-off that we need, and we're just about to open our pilot intervention pathways after Easter, which is very exciting. If we can move to the next slide. So just a couple of small challenges that we've had. So it just took time to set up our systems. So the DPIA, for example, took 4 months, which might not sound like very long, but that was a lot of kind of chasing and really wanting to move things forward. And as I said, it was helpful to have the previous experiences there. There were pressures on existing systems, so we had a change of provider from one of our health visiting services. There were some teething problems as well with the new SACS-R e-learning package, which just kind of added to their time and the challenges to kind of sort out those issues. We're taking it one step at a time, so health visiting have wanted to focus on using SACS-R with one particular age group, and then we're hoping to expand that as they gain confidence and get that embedded into their practice. And I think having those shared clinical goals has really supported us to overcome those things. The last thing I wanted to mention was just thinking about our language and how we're talking with parents and carers of very young children who are too young for our diagnostic pathway. So something we did that was really helpful was liaise with our parent carer organisation to get their feedback on our leaflets and how we were going to talk about the SACS-R, what it means, what iBASIS is for, and how that links with our diagnostic pathway, which was really useful. Our final slide, if we can go on to that, is our first feedback. So we haven't implemented our therapies yet, but the SACS-R has gone live from the beginning of March. So we've already had a couple of positive feedbacks from our health visitors. So this was somebody who used the SACS-R and just wanted to share that they were really impressed with the checklist. It was a good tool to reassure parents with, and they used it to assess whether a child would benefit from iBASIS, and actually concluded that they were not showing significant signs of autism, which had been raised by a parent. So it just kind of gave the staff member the confidence to really look in detail about how is this child presenting and what's going to best fit their needs. And they ended up referring them elsewhere to our local Portage service. And this is exactly what we wanted to happen with SACS-R, is to upskill the staff members to feel confident to make sure that children are going to the right places for the needs that they have at an early age. So a really good start.
So thank you, Sue, for that, and thanks to everyone who's joined us today, and thank you for bearing with us with those technical difficulties earlier. So as we mentioned, we're now going to move to the question and answer portion of the session, and myself and Sue will do our best to answer as many of your questions as we can. Does anyone have any questions that they want to drop into the chat? or to ask. And I've got Sue with me as well to answer.
Hi, everybody.
So Sue, I don't know if you want to share anything else about your experience with implementing the pathway.
Well, I just wondered, it's quite a nice intimate group today. I know no one has actually shared whether they're a parent or practitioner or a lead. So if anyone would be willing to just share their roles in the chat, that would be really interesting for us to see. And if you're a professional, we'd be interested to hear what your thoughts are about the pathway. So again, either feel free to drop something in the chat or to just ask us directly.
Oh, and I can see someone's asked why there were two images of myself, and that's because the presentation was pre-recorded. So you could probably see as you were watching it that I was in the original meeting that Sue and Jane recorded the presentation, and then you could also see my Zoom icon from today.
We wanted Jane's voice to be heard, so she wasn't able to make today. So that's why we've had to use a pre-recorded session. So Dr. McNeillie, is that? Sorry,
great.
Nice to see you. I don't know whether you fancy letting us know about sort of why you've joined us today and your thoughts on hearing the pathway.
Thank you very much. I'm delighted to be joining today. I'm a community pediatrician. I've retired quite a few years ago, but I'm still doing some part-time work on and off at East Sussex NHS Healthcare Trust, supporting some clinical work, education, writing reports for the EACP process and other things. Yes, I mean, I find this very interesting, to be honest. This is all new to me in a sense, to be honest. But I could see right away the usefulness of the SACS in the sense that early detection will lead to better outcome for children, for their families, also reduce the amount of unnecessary referrals because actually this is not like the autism child is fine. So I think it's very useful. But to be honest, I'm just learning, like I said, about this. But it is a fantastic tool as far as I can gather today with regards to early detection, supporting families. And yeah, thank you.
That's really interesting to hear. I mean, as a pediatrician, I imagine you were involved in quite a lot of autism assessments over your career. Yeah, I mean, I think what's great about this pathway is that as a pediatrician, you would have waited, like you said, you'd have had a long waiting list, I imagine, or lots of demand. And what's great about the pathway is that we're not waiting for an autism diagnosis to get support for the family. It is pre-diagnosis, so it's preemptive, but as a result of that early support, it can reduce the amount of demand on autism assessment services. Obviously, it's not the complete solution, but it helps. Morally, clinically, ethically, we're supporting families earlier on. And I think certainly, I mean, I've been a speech therapist for over 20 years, and it's only recently that we have come across this tool that can identify children from such a young age and where we can feel pretty confident that they are showing high likelihood of autism. Obviously, we're very careful with how we have those conversations with families because the child can change and often does change once they've had iBASIS or PACT Therapy support. But so the conversations tend to be, we're noticing some developmental differences, but usually the parent has noticed that themselves and is grateful, I think, that we're having a joined up conversation so early on in the child's development and kind of celebrating each unique child, what their strengths are, what might be more challenging for that child. So yeah, interesting to hear your role as well.
And it's really helpful as well for those children who don't score on the SACS, who score below the threshold. Then we can make sure those children are getting the right support and they can get that correct support earlier. So whether that's like language support, instead of sitting on a waiting list for a service that isn't appropriate for them, they're getting that early input as well that's correct for them. And we know that the SACS is very accurate in terms of identifying those children who aren't showing high likelihood of autism. It's about 99% accurate. If they're falling below that threshold, they wouldn't go on to get an autism diagnosis when they were older.
Yeah, thank you.
Can I?
Oh, yes.
Okay, thank you so much. Just going back to one of the slides you showed, there's a place I say light touch.
Yes.
And I just wondered, just educate me, is it that when you look at some of these early 1 to 3 years children and you think it's clear as day, as we know that it can be, that they've got autism, are you able to make that diagnosis without referring them to the MDT for formal assessment?
So we still always go through the MDT process, but when we're saying about a light touch, because the practitioner has worked with the family and the child for 5 to 6 months, that's often a longer time than I know when I worked on autism assessment pathways. I didn't get that much contact with the family through the autism assessment. So the practitioner's built a lot of assessment information. It's very dynamic assessment from seeing and working with the family, but they can feed that into the MDT discussions. So it would be part of an MDT, but when we say light touch, it might be that the paediatrician might only need to meet the family once, and that might be corroborated with that evidence. And also in Stockport, certainly a move away from necessarily having to do a full ADOS, because like you said, if it's very clear, we've got very clear signals, that reduces time and input that way. But for children, as we mentioned earlier, who are maybe more on the threshold or where it's less clear, they would still go through that longer assessment, which could involve ADOS or other assessments. Yeah. Thanks. It's Toyin or Toyin? So I don't know whether.
No, sorry. My name is Shola, S-O-L-A.
Shola. You've got a different name that's come up. Shola,
yeah,
right?
That's my wife's name.
Oh, right.
Yeah.
Okay. Oh, yeah. Brilliant. Thanks, Shola.
Yeah. What you actually said last is similar to what I used to say, that, yes, every child with autism needs multidisciplinary support, but making an assessment does not always have to be, because if you've got a lot of information, like you said, a pediatrician-only clinic will suffice, because look, it's clear as day, the child walks in your room, you've got all this information, he's looking around, not showing you any awareness, doing all sorts of things, not interested in the choice. You can actually make the diagnosis without going to formal ADOS, ADIR, and all that. That's always been one of my things that I used to say. Yeah. So thank you.
Absolutely. I totally agree.
And it's better for families as well, because they're not having to go through that process and go through all the same questions with new people when there's already someone who knows them really well, who has that information. Yes, I definitely agree with that.
Thank you so much.
Thank you, Charlotte.
We've got another comment in the chat from Erica, just saying that you're a non-medical prescriber, about to start a children and young person ADHD service in the NHS, and that you'll be that you're interested in sort of finding out more about this. It can it fits really well with existing services. If you have existing pathways in place, the pathway that we have is very flexible, and we can adapt it to fit with what your service already offers, alongside what the new things you might want to offer.
Yes, yeah. And I don't know whether, Erica, you want to add any comments? I don't want to, or.
Oh, no, just to share how interesting this was. It's new for me. I have not heard of this before. And I'm just kind of delving into the world of neurodiversity and ADHD and autism. So this is quite interesting. So thank you.
Oh, no, you're welcome. You're welcome. Great to hear from you. So I don't know whether we have any other questions today. think that might draw us to a close. I don't know, do you have a closing statement?
Yeah, just again to thank everyone for coming, and just a reminder that the session's been recorded, so you will receive the recording after the webinar, and it will also be available on the website if you want to look again or share it with anyone. And we know that there's a mixture of people who've joined us from different backgrounds, and we hope that everyone has been able to find this session helpful and accessible, including any parents or carers. We'll be sending a short feedback survey after the session, and we'd really value your input, as it really helps how we deliver and develop future webinars and helps us ensure that our content is useful and relevant. Your feedback also really helps us demonstrate the value and impact of what we're doing, which is really vital in supporting wider awareness and implementation of these programmes and pathways. And it should only take a couple of minutes to complete, so we would be really grateful for your time with that. So this is part of our ongoing webinar series. Our next webinar will be Growing Together, the PACT programme and related therapies, and that will be delivered by Wilson Mora, who's a PACT practitioner and trainer, and someone who's very passionate about the PACT programme. So we'd really encourage you to join us for that session, either in person or by having a look back on our website to access the recording. So thanks again for being here. Thanks for your interest, and we hope to see you at the next webinar. Thanks.
Thanks, everybody. All the best. Bye.